Go ahead, Judith.
Good evening. Thank you for joining us. My name is Judith Clark, Executive Assistant at BARP, and I will be your moderator for this evening's session entitled Preventative Care, Staying Well at Every Age, which will be presented by Dr. Rashida Daisley, Assistant Professor at the Ross University School of Medicine, and Dr. Bandele Majeks, Managing Director at Urgent Care Barbados. Before we begin, just a few housekeeping matters. This meeting is being recorded and will be shared to BARP's YouTube channel. If you prefer not to appear in the recording, please turn your cameras off at this time. All participants will be muted upon entry to ensure a smooth experience for everyone. The meeting will be open for questions during the question and answer segment. At that time, you may either type your questions in the chat or use the raise hand feature located next to the chat button in your Zoom app or browser. With that, we'll get started. It's my pleasure to invite our president, Ms. Marilyn Rice-Bowen, to deliver the opening remarks.
Thank you very much, Judith, and good evening to all. I want to acknowledge the members of the BARP Board of Directors, the management and staff of BARP, and our partners and friends and presenters, Dr. Bandele Majeks, the Managing Director of Urgent Care, and Dr. Rashida Daisley, Assistant Professor of Ross University. And of course, a very special welcome to all BART members because we all have a burning interest about preventative care. And it's because at times that we get afraid that we don't seek help as early as we ought to. So today, our theme, BARP's overarching theme, is Healthy Aging, Aging Strong. And when you think of preventative care is indeed the foundation of a healthier community by focusing on early detection. And early detection, I'm certain, I haven't seen the script of the presenters, but I'm certain that that is a thread that will come right through the presentations. Early detection, routine screenings and healthy habits and proactive management of risk factors, we can reduce the burden of disease before it begins. Investing in prevention not only improves quality of life, but also strengthens families, workplaces, and healthcare systems. So today, as the need and importance of preventative care is highlighted, I invite you to make notes. Of course, you will have burning questions and they will be addressed. And relax and don't be afraid. But the important thing, if nothing else, you remember this evening, remember the importance of early detection. And part of BARP's remit is to ensure that our members lead healthy lives as we continue to age. So it is indeed a pleasure to welcome Dr. Majeks and Dr. Rashida Daisley as they share with us their knowledge on preventative care. Good evening to all and welcome.
Thank you very much, Madam President. Permit me at this time to share a little on our presenters. I'm sure you'll be interested to know who they are. Dr. Rashida Daisley is a physician, public health advocate, and educator committed to health, equity, policy, and global health. She holds a medical degree, a Master of Public Health with merit in global health, a postgraduate diploma in obesity and weight management with distinction, and is currently pursuing a health doctoral degree. As an assistant professor of community medicine and global health, Dr. Daisley shapes future physicians by emphasizing the importance of social accountability and community action in her teaching, inspiring her students to advocate for and address health disparities. She previously served as clinical director of the Barbados Family Planning Association, BFPA, expanding healthcare services for underserved communities, including specialized clinics for LGBTQIA plus individuals. She also led collaborations with organizations such as Sexuality, Health and Empowerment, SHE, and Equals Barbados to improve access to inclusive care. Dr. Daisley is a strong advocate for women's health and served as president of the Barbados Association of Endometriosis, polycystic ovarian syndrome, BAEP, where she contributed to the advocacy, research, and strategic planning efforts of the organization. Her health equity advocacy focuses on vulnerable populations, including the LGBTQIA+ community, youth, women, and young girls. During the COVID-19 pandemic, she played a key role in maintaining essential health services and securing resources for marginalized groups at the BFPA, and was recognized nationally when she was awarded a Barbados National Humanitarian Award. This evening, we welcome you, Dr. Daisley.
Thank you. Good evening. Thank you so much for that. So I do have some slides, so I'm just going to go ahead and share my screen once I'm able to do so. So I don't often share on Zoom, so let me just confirm which slide I'll be looking at. One second. Several screens, so apologies. I see, just confirming that you guys are just seeing my slides.
Yeah, we can see.
Okay, wonderful. So thank you again for having me here today. It's a pleasure, as always, to join with BARP. Both BARP and Urgent Care are very valued partners of us here at Ross University. We're going to be discussing today preventative care, which is the foundation of our screening clinics that we host with BARP in collaboration with Urgent Care at least once to twice per month. So I'm just going to go through, what preventative care is and how you as an aging population would be able to engage in that. All right. Again, I think you guys are seeing the wrong screen. All right. All right, so let's start by looking at what is preventative care. So as your wonderful president had mentioned, preventative care helps us to identify conditions early. So it's taking steps to not only prevent illness, but to find problems early, to manage the risks before they become emergencies. So what does that really look like? In the context of our clinic, so that can look like blood pressure checks, blood sugar screening, cholesterol, and so on. But at more advanced or more established clinics, such as Urgent Care, I'll do a small plug here for Urgent Care, that can also expand to things such as cancer screening. And when we talk about cancer screening, that can include a variety of different cancers, including prostate cancer, colorectal cancer, breast cancer, and even cervical cancer. We can also think of preventative care in terms of some different aspects of our health. So that can include things such as eye checks. So we're looking at our vision. So not only looking at, our visual acuity, but there are also some conditions that come along with our as we get older. So things such as glaucoma should be screening for, as well as cataract. We can also look at dental care as well, so preventative dental care, and also vaccinations. So vaccinations are a core aspect of preventative care. As we were growing up, we would have gone to our polyclinic or to our pediatrician to have our vaccinations. And as we get older, these are equally as important. So recently, we went through the COVID-19 pandemic where we all had to have our COVID-19 vaccine. But there are also other vaccines that are really important as we get older. So things such as our flu shots are also of significant importance as persons get older. So flus are quite seasonal, so you will have to get these vaccinations every year. But as you get older, it's really important to have that to ensure that you're mitigating the impact that flus can have on us. Also, things such as medication reviews are also quite important. So oftentimes as clinicians, when we see patients come in, we hope that, they're coming in very frequently for their preventative care, but sometimes that may not happen. So sometimes they may be taking their medications for a prolonged period of time without having a review of those medications. And even something as simple as that can be quite critical to a person's care. And also, utmost importance is a lifestyle support. So we're talking a lot about, the medical aspect of things and what us as clinicians can do to help to manage your preventative care. But the onus really is on you as patients. So when you go home, when you leave our office, we give you your medications, we give you, the advice. The onus really is on you when you get back into your environment to really ensure that you are sticking to an adequate nutrition routine, activity routine, physical activity, and sleep. So preventative care encompasses all of these different aspects of discussion. So why does it matter, especially as we're getting older? So aging is normal. So it's something that all of us have to go through once we are alive and thriving. However, decline doesn't always have to be inevitable. In Barbados, we have a wealth of centenarians on island, and as they get older, several of them are still able to move around. They're still quite healthy, and we want to make sure that as clinicians, both here at Ross University and Urgent Care, that we're facilitating that you're aging well. So as we mentioned beforehand, a really critical aspect of that is catching issues early. And in the medical community, we call that screening. So the clinics that you would see would come out in terms of inviting you to see us at BARP's facility are screening clinics. So that means that we're going to be looking to identify several of these conditions very, very early. And we're going to talk shortly about what these different numbers mean and how we can discuss mitigation of them. So beyond catching issues early, we can treat them simply. So for example, if you think about something such as cancer, if you're able to identify cancer early rather than later, then you're able to have a lot simpler regimes, hopefully. So that can be things such as reduce surgery. It can also be the impact of your duration of things such as chemotherapy, as well as other types of supportive therapy. So you can have simpler treatments. And this also stands still also with other conditions such as diabetes and hypertension as well. It can also help in terms of supporting your independence. So as you're getting older, sometimes you may be empty nesters where your children may go off and start their own lives. And you want to be able to have, that longevity and continue to have that vibrant lifestyle that you had beforehand. So maintaining preventative care is really critical to that. So beyond, coming in to see us as clinicians, ensuring that you're staying physically active, that you're making sure that you have resistance training. So that physical activity is not only cardiovascular exercise like walking, but also making sure that you're building that muscle mass that really does help to improve your longevity, especially for us women. It can also boost your memory. It can protect your energy, And most importantly, it can give you peace of mind. So they have been research study that shows that preventative care, for example, things such as physical activity, eating well, not only has a benefit in terms of our physical body, but it also does help to improve our mental state as well. So it reduces the incidence or occurrence of things such as depression, anxiety, and so on. So it's really important as we're getting older to ensure that we're incorporating this into our lifestyle. So let's talk a little bit about some of the common conditions. So one of the things that, persons may be hesitant to come out to screening is, they say that they feel fine. So as a practicing clinician, oftentimes when I'm talking to my patients, if they have a blood pressure that's elevated, they would say, man, doc, I'm shocked. I feel perfectly fine. And that's really important for us to discuss here today because persons often think that because they feel fine, that everything happening in their body is also in tip-top shape. But many of these conditions, especially chronic lifestyle conditions, are insidious. So they may not start with, these red flags, but they're starting to develop and to strengthen, they then start to develop these symptoms. So what we want as clinicians is to identify these conditions early through screening so that we can help to mitigate them. So blood pressure or high blood pressure, also called hypertension, is a really, really critical, important aspect of that. So oftentimes they have no symptoms at all until complications occur. One thing sometimes my patients would mention is that, they may only take their blood pressure medications when they have a headache. We want to get away from that thinking. So high blood pressure, as we see here, does not always have symptoms. So it's not only when you have a headache that your blood pressure is high. So your blood pressure can be high without you having any symptoms at all. No headache, no chest pain or anything like that. And that doesn't mean that it's not causing impact on your body. As the blood pressure remains high, it continues to put strain on your critical organs. So things such as the heart. So pushing against that really strong high blood pressure causes the heart muscle to become thicker. And as a result of that, it may not function as it should. So we want to make sure that, with medication, we're gradually reducing that blood pressure so we can reduce that impact on the heart. It can also impact other organs as well, such as our brain, our eyes, and our kidneys. Another aspect that we hear, or another condition that we hear quite often is diabetes or high blood sugar. So similarly to high blood pressure, sometimes it may not have symptoms until complications occur. However, diabetes does have some symptoms that, you may be able to pick up. So things such as, feeling very thirsty very often, feeling very hungry, almost insatiable. Those are symptoms that you may see. And sometimes if the diabetes is very advanced before it's diagnosed, you can also have some weight loss as well. We can also see this with high cholesterol as well, kidney problems, and vision problems. So what I really want to highlight here is just because you're feeling well does not mean that you do not have these conditions. So attending things such as these screening clinics are of critical importance. So what can preventative screening do for you? So the first thing that I would highlight is that it detects these risks very, very early. So beyond, this actual checks we do like blood pressure, blood sugar, and so on, you will come into our clinic. You'll be met by one of our Ross University faculty, but you'll also be met with very, very skilled and competent clinicians from Urgent Care Mobile, as well as our student doctors as well. And what they do is that they take a full history from you. So they're able to ask you questions about your medical history, your surgical history, and most importantly, what symptoms you are experiencing right now. And that helps us as clinicians to be able to, act as detectives and put things together to identify whether you may be at risk for these particular conditions. And that's really important because if you identify you have heightened risk, we can give you customized or tailored advice on how you can best mitigate your risk. It is also important for you to know your baseline. So let's say you're one of those lucky few who actually do have completely normal numbers. It's still really important for you to attend screening clinics so you have an understanding of where your baseline is. So having that information equips you to then know when things are abnormal. So many persons now have blood pressure machines at home. After COVID-19, we have the oxygen fingertip machine at home that we can check these numbers as well. So if you have an understanding of what your baseline is, when you do check it at home, you are able to identify, well, this is different than what my normal numbers are. It can also help you to make informed decisions in terms of your management. And most importantly, it lets you act early. So by identifying your risk, by identifying your baseline numbers, you're able to then institute these different changes in terms of diet, activity, and medication under your clinician's guidance to help prevent the progression of some of these conditions. It prevents complications, and most importantly, it gives you as a patient some peace of mind. So I really want to talk about some of the common reasons that people delay screening. So as a clinician, sometimes patients may come to see us a lot later, and as a result of that, we may identify complications relating to these conditions. And when you have a chat with these patients, they oftentimes may share, what are some of the concerns that prevented them from coming forward. So I really wanted to kind of discuss this so that we as a community here can discuss how we can move forward. So the first one I think I addressed already is I feel fine, so I don't need it. So as I mentioned beforehand, many of these conditions are silent. So very early in the development of these conditions, they're silent. So you will feel completely fine, even though they may be starting to manifest. And screening can catch what you as a patient are not able to feel as yet. The second one is one that I see quite often, especially as it relates to cancer screening. And persons often say, I don't want bad news. So they may be concerned, about, I have this diagnosis of diabetes or hypertension. They may see this as bad news and may impact their mental health. But understanding or having a knowledge of having these conditions is just information and is really important information as well. So finding these issues early can help you to make more informed choices and to help prevent the progression of these diseases and also helps to lead to better outcomes as well. The third one is probably one that I myself I'm quite familiar with is I'm too busy. So we may say, I'm too busy to go to see the doctor. I'm too busy to go get this preventative care. But when we do have a major disruption in our life, it stops everything. You may have busy schedule and so on, but once you're ill, your entire focus and concentration is on your health. So we have to take that into our daily activities as well. So ensuring that we're creating a space to ensure that we are attending screenings and also instituting some of these changes into our lives to mitigate the development of them. The fourth one is one that personally hurts my feelings, and I'm not sure if it also hurts yours, Dr. Majeks, but I don't like doctors. But I don't know about you guys, but I don't bite. So I'm oftentimes when patients say that, I don't like doctors, I'm also often very hurt. But, by coming to the doctor, especially for these preventative visits, it can help you to build a relationship with us. Oftentimes at the screening clinics, you may see some familiar faces. So I'm there quite frequently. Some of the urgent care physicians often come back quite frequently as well. So you begin to build a rapport with us and you start to feel comfortable. As a result of that, you may feel more comfortable opening up and, the screening process may not be as, concerning or alarming to you. And these screening sessions are very supportive and they're low pressure situations. So we do really encourage you to come out. Also, persons may also say, I already know that I need to do better. And that's one, that we all grapple with, especially when we're trying to make some lifestyle change. I know that, I need to put down the sweet biscuits. I know that, I need to stop, putting so much salt in my food. I know what I need to do, but you may not be doing it. Or if you're doing it, you still need to track your progress to see how this is actually impacting your chronic diseases. So if, for example, you know that you need to reduce your salt intake. So when you are able to do that, the next step is to understand, well, how is that impacting my hypertension? So to do that, come into the screening clinics to look and see, where your blood pressure reading is really important for you to see how you're progressing. So I just wanted to give an overview of what to expect when you come to the clinics. As I mentioned beforehand, you will see one of us Ross faculty. So either myself or you may see a Dr. Lazar, Dr. Radix are some of our sessional faculty. So we're there both to, guide you as the patient, but also to, guide our students as they're engaging with you. And you'll also be presented with a wonderful faculty or wonderful staff, sorry, from Urgent Care Mobile. So that would either be a physician or a nurse. And we're there, to take your history and to give you these basic health checks. So what are the health checks that we typically do? So we definitely do blood pressure, we do blood sugar, and definitely a favorite of persons is our cholesterol testing as well. In addition, we do weight and BMI. Sometimes persons, including myself, I must say, get a little scared to go on the scale, but it's important for us to know. And we also do other things as well, such as your temperature. We also check your oxygen saturation and your heart rate, which are aspects that are often overlooked, but they're really important and can give us some clues to kind of guide or support, some of these other checks, for example, blood pressure, to let us know how your heart is doing. It's an opportunity to ask questions. So for example, you may be home, you may be online, on Facebook or on Instagram, you may come across some health information, or you yourself may be, feeling a little uncomfortable or having some symptom that you want some guidance to, but you may not be able to go directly to your physician at that point in time. But we definitely welcome you to come to the clinics so you can ask us these questions and we can elaborate on, what we think may be happening and then guide you to your next steps, such as referral. And I just wanted to reiterate here that this is confidential information. So nothing you say to us within those rooms would leave there. So not even to any of the BART personnel. So it just stays between you and the clinician, and it does not leave there. So it's definitely confidential. So I want to, just recommend that you make your health a priority and you take an opportunity to come to the clinics. But I also wanted to talk a little bit about some of the specific things that we look for. So we mentioned before we do blood pressure screening. So the reason we do that is to identify the silent killer, hypertension. So blood pressure simply is just a force of blood pushing against the walls of your artery. So when you think of an artery, so the artery is just like a tube. I'm not sure if any of you are plumbers or, have done anything with plumbing, but you have that pipe. So it's just our arteries are very similar. So it's just a cylindrical tube. And unlike the pipe, our arteries, the walls of our arteries are elastic, so they're able to stretch. So what happens is that as our blood pressure increases, it pushes against the walls of our arteries. And our arteries are many places within our body. So our arteries are in our heart, arteries are in our brain and our kidney and so on. So when we have this elevated pressure, it impacts these vital organs where these arteries are. So for example, impacts our brain can lead to things such as stroke. It can also lead to things such as heart disease if it impacts our heart, kidney damage, and vision loss as well. So when you come in to have your blood pressure checks, you'll see two numbers. You have your top number and your bottom number. Our top number is called our systolic blood pressure. So that's when our heart contracts. So whenever we have a heartbeat, our heart goes through two phases. So that contraction and then the heart relaxes. So the top number tells us about when the heart contracts and the bottom number tells us about when the heart relaxes, right? So the top number, we want a number to be around 120 or a little less than 120. And for our bottom number, our diastolic blood pressure, we want that less than 80. But we will see some slightly elevated numbers. So we will accept around 120 to 129. But as we get beyond that, we get into the territory of hypertension. So anything over 140 for the top number would be considered hypertension, or 90 for the bottom number as well. I would say this small caveat is that as we age, our vessels naturally harden. So our blood pressure naturally rises as we get older. So as you come in for your checkups with us, we will give you some information on how we're interpreting your blood pressure on the background of your age. So if you, for example, are above 60 and we understand that your arteries will naturally stiffen, we will take that into account. I also wanted to chat a little bit about diabetes as well. So type 2 diabetes is what happens when our body, the insulin, which is a hormone, which acts almost as a key for our body to access the blood sugar that's within our blood, our body is not able to react or to respond to that insulin as well as it should. And over time, so that can impact similarly to blood pressure, it can impact our heart, our eyes, our kidneys, our nerves, and so on. So similarly to hypertension, oftentimes persons may have no symptoms until very late. So we also want to make sure that we are screening for diabetes as well. So understanding the numbers. So typically there are two ways that we can screen for diabetes. So the first one is what we call our HbA1c. So those of you who may be diabetic may be quite familiar with this. I will say that we do not do the HbA1c test at the screening clinics. We just do your either random blood sugar or fasted blood sugar. But the HbA1c test gives us an idea of how your blood pressure control has been over the last 2 to 3 months. So it's really important for persons who are diabetic to have this test done regularly. Versus our fasting blood sugar or random blood sugar, it's just that little finger prick that you'll get when you come into the doctor. And that just gives us a snapshot of how your blood sugar, is doing on that particular day. So oftentimes if it's elevated, we would recommend that you go to either your clinician or go to see the physicians at Urgent Care so they can then do that HbA1c test so we can see how that blood sugar has been doing over 3 months. So putting those two things together can be quite important. So I have a graph here that highlights, what the fasting blood sugar levels are. So if your fasting blood sugar is below 3.6, that's a good range. If it's between 5.6 to 6.9, that's what we call pre-diabetes. So that's just the stage before diabetes. And then lastly, we have above 7, which is where we're entering that diabetic range. And I would say that it's really important if you do have a finger prick that's elevated at these screening clinics, we're not going to diagnose you with diabetes there based on that unless it's significantly elevated. But we will then refer you on to either urgent care or to your primary care physician to have further testing done. So that's it for me for today. So I will be around to answer any questions, but I hope that this session really highlighted the importance of preventative screening and preventative care. And we do encourage you to come out to the sessions so that you're able to, take advantage of all of the screenings and take advantage of having 2 clinicians actually. So you have both myself or a Ross doctor and an urgent care doctor. So you have 2 doctors there that you can talk to provide you with some really tailored and customized care. So thank you guys so much for listening today.
Thank you, Dr. Daisley. And our next presenter will be Dr. Bandele Majeks, who is an emergency physician with over 20 years of clinical practice experience. He graduated from the University of the West Indies in 2003 and subsequently trained and worked in the United Kingdom in both emergency medicine and general surgery. In 2015, he completed his Doctor of Medicine in Emergency Medicine at UWI, solidifying his expertise in acute and critical care. Dr. Majeks is the co-founder and medical director of Urgent Care Barbados, Inc., which he leads alongside his partner, Dr. Makiba Brooks. Together, they have built one of the island's leading healthcare organizations, delivering accessible, high-quality care through urgent care clinics, imaging services, ambulance and mobile care, and the soon-to-be-launched Welch's Hospital, a state-of-the-art facility that will expand access to surgical, inpatient, diagnostic, and wellness services for the people of Barbados. Throughout his career, Dr. Majeks has combined his passion for emergency medicine with a commitment to healthcare innovation and systems improvement. He's been at the forefront of integrating advanced diagnostic tools, digital health solutions, and artificial intelligence into clinical practice, always with the aim of improving patient outcomes and expanding access to care. In addition to his clinical and administrative roles, Dr. Majeks is an advocate for medical education, professional development, and the training of the next generation of healthcare providers. His work has not only strengthened the private healthcare sector, but also contributed meaningfully to national healthcare resilience, particularly through the COVID-19 pandemic, when Urgent Care Barbados, under the leadership of Dr. Majeks and Dr. Brooks, played a central role in community testing, home care, and vaccination support. Dr. Majek's vision is to position Barbados as a regional leader in modern patient-centered healthcare delivery, blending clinical experience with technological innovation. Good evening, Dr. Majeks.
Hello, good evening, and thank you. It's quite a pleasure to be here, quite an honor to be here with everyone, and I'm very pleased to see the attendance is actually quite significant. I think our partnership with, I have to say, our partnership with BART goes a bit beyond, and that's largely through your president, Ms. Marilyn Rice-Boyne, who I have to say has been a very important figure in my life, and certainly in my development. I would like to highlight the partnership that we have started with Ross University and BART as being one that I think is in itself a significant innovation. And why that is, we are partnering across three spheres, really. One in which is urgent care, and as the name suggests, we're talking about acute emergencies. But we're actually now focusing not just on urgent care, but on the aspect of prevention, because we want you to be well. You know, we don't necessarily want to see you when you are unwell. And, you know, the ability, the notion of partnering with Ross University as well as BART in order to deliver these medicals, these preventative wellness medicals, it really means a lot to us to be able to sort of contribute in that way in the community that is part of Barbados. And furthermore, I think it also means a lot to us to be able to give back, not only to our community, but to the healthcare community by nurturing and developing medical students in this journey that is healthcare. So I'm going to share my screen. Okay, can everyone see my screen?
Yes, we can.
Okay, so I have to firstly thank Dr. Daisley for her wonderful presentation. She was able to, I think, she did a very comprehensive job, and there's really not a lot left for me to discuss as it relates to preventative medicals. But I will like to summarize a few things, stress on a few of the important things that she mentioned. The first one being Dr. Daisley, surprisingly, no patient has ever told me that they don't like doctors. So I'm not quite sure what you're doing. Just joking. So yes, so we're talking about the power of preventative medicine. And Dr. Daisley did spend a lot of time talking about the silent killers. I'll just move past that. And this is very important because at urgent care and working as an emergency physician for a long time, we often see patients who present to us in what we call essentially very life-threatening heart failure. They present with the sequelae of a heart attack. They present with sudden onset of kidney disease. They present with severe headaches. So a lot of the things that we see people presenting to in the urgent care setting and the emergency setting are preventable. They just need to be caught early. And it is so interesting to, we as individuals, when you think about the things that we do for our vehicles, we understand, as we talk about cars, for example, that they need to have maintenance and that if they don't get maintained, then they will break down. When we put that into reality and you think about your life, how fragile it is, why are we continuing to take the chance of not knowing what our numbers are? Something that will make a significant difference. And oftentimes we think, well, you may think, well, if something happens to you, you die, which is, worst case scenario. But there are other possibilities beyond death, which speak to illness. So that young man who is actually 45, 50, who gets a stroke and becomes paralyzed on one side of his body is no longer able to help himself. That young man or young woman who gets a stroke, who gets a heart attack, for example, at a very young age and does not die, but is no longer able to care for themselves, becomes a significant burden to all of those, their community, their relatives, their loved ones. And they're no longer also able to contribute meaningfully in a financial way to society, to their own household. So those are things which, once again, I say are preventable, and something that we need to consider as we go about on our day-to-day basis, often thinking we're afraid of diagnoses, we don't have the time to do it, or we think that it's too expensive to do so. If there's one thing about healthcare in Barbados, for the most part, it can be accessed free, it can be accessed through insurance, and now it can be accessed through BARP. So many serious illnesses progress silently. Early detection, we're stressing very much today, can change the outcomes. So we've mentioned what some of the silent killers are. I don't need to go over them again. And Dr. Daisley was also very detailed in talking about what are some of the different tests that can be done at the medical. I think it's important to stress at this point that the medical, for all intents and purposes, is a basic medical. And she did stress on what some of the tests are. Yes, you can get blood sugar and weight and BMI and physical examination. I think we have to stress that these, while we're sort of coaching and teaching medical students to examine and assess patients, it is also done by doctors who are seasoned or are very experienced. I'll make one point here. When I myself was a medical student not so long ago, I remember going around having examined a patient. And if there's one thing about medical students, they tend to be very, very thorough. So I had done this assessment of the patient. I sat with the patient probably for over an hour or so, from head to toe. The then doctor, who was already qualified, came and examined the patient after. We then had to go and make a presentation of the patient to our consultant who was managing. And what came from that was that I picked up something as the medical student that the doctor had not. And quite simply, I was very detailed. So I say all that to say that an examination and assessment by a medical student is nothing to be sniffed at. It is as thorough as you are going to get. So why is this initiative by BARP and Ross University and Urgent Care important? So one, yeah, it is free. I think it's very well executed. It's private, it is seamless, and the staff are there. Everyone wants to do their best, and they want to make sure that you, the client, the patient, feels comfortable. And this is one of those scenarios where you can actually come to a space which is not necessarily a doctor's office, and you're not unwell. I think, we oftentimes think, well, I can only go to the doctor when I'm not well. But the thing about being not well is that you often don't answer all the questions that you want to answer. You don't remember everything, quite simply because you're not well. So it's important to point out that being well when you get that assessment can actually be quite useful. In addition, however, to all of the blood tests and weights and whatnot that we do, the screening, actually the questions that come, that discussion that you have with the medical student or the doctor, which seeks to elicit more information about how you're feeling now, maybe how you felt last week, important details about that may speak to a little bit of your genetics, about your family history, your family background, your social history, your occupational history and things that may impact you, as well as your mental health. These are all things that must be strongly considered and factored in to a wellness assessment. And the very good thing about this partnership with Urgent Care is that all of this information is documented privately in our patient portal. Now, that patient portal is something that is kept and retained by us at Urgent Care. And in the event that you happen to go to Urgent Care for any other reason, when you're not feeling well, the doctors that are seeing you will have access to that information. I should stress that no one else from BARP or even Ross University has access to that information. So I've spoken a little bit about this. I think we are so thrilled to be a part of this, mostly, because we are part of the pipeline that produces the healthcare providers of tomorrow. And that really means quite a lot to us. So Urgent Care Barbados, as mentioned a little bit earlier, we opened our doors in 2016. And believe it or not, we started just as the name suggests as Urgent Care. We started as Urgent Care Mobile, where our doctors went out to patients' homes, serving in the community. And the reason why we did that is because a lot of the physicians that started, 4 of us, who started that business in 2016, we worked in the accident emergency department. And we recognized that there were quite a lot of people who were coming into the emergency department who did not need to be there. Because one, of course, if they had issues that could have been prevented, but also 2, as they had their issues, some of the issues that came up, there were actually routine healthcare issues that weren't being addressed. And oftentimes it was because they simply couldn't get to a doctor. So the easiest thing to do is to call an ambulance. So we found that, there needed to be a greater level of community engagement by some of our physicians. We needed to get back to the old days when a doctor went around with a briefcase. People needed to know in the middle of the night, if something is wrong with me and I can't get to a doctor, who do I call? And I think that was the call that we decided to step in and answer. And we subsequently expanded, of course, into a healthcare facility, which goes beyond urgent care, because it offers all of these preventive wellness examinations in our clinic, which can do far and beyond what we've discussed in terms of the basic medical. But we're now talking about, as Dr. Daisley mentioned, HbA1c, but ECGs, which is a heart evaluation, kidney evaluations. You can check also to make sure, people who may be on the verge of having a stroke, people who may be having, because one of the silent killers that I haven't mentioned here is cancer, the big C word. And, that if we detect early can make a huge difference. And there's certainly lots of different means and modalities that we can use. Next up for Urgent Care Barbados, which is coming later this year, will be a hospital. And so for us, our healthcare suite of services, we want to be able to offer prevention. But if you do get unwell, we want to be able to treat you either in your home, in our facility, or at our hospital in the event that you need an operation or you need long-term care or inpatient care, as we say. So beyond the basic medical, what are some of the things that we can do? I think Dr. Daisley touched on quite a few of these, but in addition to some of the blood tests and whatnot that we may do, we mentioned cancer markers. And I just mentioned ECG. We can do something called a CT colonography, which checks for colon cancer. We can do ultrasounds of the abdomen, which can look for abnormal growths and whatnot in your abdomen. CT chest, which again looks at certain abnormalities in your chest. So your medical can be as basic as it is, and it can also be quite robust. The level of the medical that you need is often something that you can discuss with your physician at the free healthcare clinic or free preventive clinic at BARP, or certainly at our facility or even with your own doctor. So I think the important thing is to get across is, yes, we are talking about urgent care, but certainly any physician that you have, you may have your own physician already. These are discussions that you should be having if you're not having them already about what are some of the preventative assessments that you should be having. All right, so early action prevents a whole lot of illness. And I think that one of the points that we want to get across, and Dr. Daisley, I keep repeating, she touched on this particular thing. Preventative medicine, preventative healthcare does not start in the doctor's office. It does not start at the BART Medical. It actually starts with you and how you live your life. So we're talking about your diet, what you're eating. We're talking about your exercise. And that is critically important. And it's important for us to stress that exercise is something that can be a family activity. It's not just about you. So you get all your family on board, get everyone in the household involved in exercise and make it fun. It's not a chore. Oh gosh, I have to go and exercise and run a couple of laps. No, whatever you do, we just want to get the heart moving at least, they say, 5 times per week. And 2 of those days, that's 30 minutes each time. 2 of those days, we also want to get in some strength training. So in the gym, or whether it might be at home with push-ups, squats, various exercises that you can sort of go on the internet or YouTube and do. But we want to try to get as active as possible from as young as possible. So even though we're talking about BART, as young as possible should be exercising. It's important to stress on that as well. So take control of your health. I encourage everyone, even if you have a general practitioner that you see occasionally or regularly, this is still available to you. It never hurts to get another opinion, never hurts just to have your numbers checked and stay ahead of any potential illness. I want to thank you for your time and being with us today. And I open the floor to any questions or comments.
Thank you, Dr. Rashida and Dr. Majeks. I now open the floor for your questions. If you have questions, please remember that you can either place them in the chat or you can use the raise hand feature where we will acknowledge that you have a question to ask. Your mic will be opened and we will invite you to go ahead. Do we have any questions?
I suspect this may be that the fear of the doctor is coming in. So
There are questions in the chat. There's a
Oh.
question in the chat, Judith.
In the chat, okay.
It's more a comment than a question. The person is saying one of the reasons could also be the cost of the visit and the test.
It's a very good point.
Mm-hmm.
They would have heard me mention though that healthcare, regardless, the starting point of healthcare in Barbados is free. So they have the polyclinics available outside of the BART Medical. They have the polyclinics available who can start the ball rolling. The Queen Elizabeth Hospital is available. Yes, it takes some delays, but I would encourage everyone, certainly if, as members of BART, we can talk about the insurance plan and what is available to them in terms of advanced testing as well.
Well, I can share that I have attended the clinic. I've also invited my mom, who's a BART member, to attend the clinic, and I sat in on her session. And I was quite impressed with the service, as you said, the student doctors were very, very warm, very engaging. And the questions that were asked, it was clear that the screening wasn't only about blood pressure, the sugar, but also the well-being of the patient. And I thought that that was quite interesting because even your social support, your support systems, which, as you did mention, Dr. Rashida, speaks to your mental health, because a person could be unwell, and I don't know how loneliness shows up as illness. Does it show up? Can someone be feeling unwell because, the bottom line is that they're lonely?
Yeah, so that most definitely can happen. It can manifest as depression. Sometimes it can also manifest as anxiety as well. But you also raised a really important point that I wanted to touch on, which was the importance of the social aspect. So as you mentioned, the students oftentimes don't limit the questions just to, the medical history, but they ask about, where persons live and so on. And that speaks to the impact of the social determinants of health. So beyond, just, what we eat and how much we exercise, there's so many different dimensions in our environment where we work, where we play, that impacts our healthcare outcomes. So we try to inculcate within our students an awareness of that. So by asking those questions to you as the patients, they're able to get an understanding of that, one. But two, sometimes you, the patient, may not have been thinking about that aspect as well. So it kind of also triggers your thinking to think about, well, maybe, my stress at work maybe impacted my healthcare outcomes, or, maybe my the way I'm eating, or, my education and so on may have impacted that. So we do try to broaden it to kind of look at those other aspects. I see a hand raised.
Okay. I see T. Keiser, you have your hand raised. Please go ahead and ask your question.
Hi, good evening, everyone. I was listening attentively, and it's very interesting what the presentation so far. But my query is that most of the time, doctors will focus on high blood pressure and so on for strokes and so on like that. But sometimes you could have an actual clotting condition. So is there a local screening for that where you can test to see if the person might have a clotting condition where blood clots are formed?
That's
Question.
That's an excellent question. So usually you would have to have a risk factor for a clotting condition. That may be a family history, or you may have had a clot, some sort of clot previously, or genetic. We know that there's some people who have a genetic predisposition to clotting. Usually that's something that's discovered earlier in life, I would say. But yes, there are tests if we have a high index of suspicion that you have a clotting disorder that we can screen for.
Does that answer your question fully? Yes.
There's another question in the chat.
I'm seeing two questions.
Right, go ahead.
One question is, are there any special rates for from Urgent Care for BART members? And the answer to that is yes. There is a special rate. That discount is offered to BART members. There's also a discounted rate for the certificates that you need for your
Driver's license.
driver's licenses. Yes.
Yeah. I think yes, we do have a BART discount. As you know, the whole advantage of being with BART is certainly that you are offered that BART discount. So we do offer that at Urgent Care. The other thing to mention, as I sort of touched on, is, and y'all can correct me if I'm wrong, being a part of BART gives you access to the medical plan, medical insurance plan.
Yes, it does.
Yeah.
Right. So
Yeah.
certainly then you would also enjoy the benefits of that medical insurance plan, of which a free preventative medical is available as well.
And
Okay.
Doc, would you want to expand more on the preventative care medical? Because some people are not too sure.
Sure,
how
certainly.
Please, yeah.
Certainly. So in most, and I don't know the specifics of the BART plan, but most insurance companies, when you've signed up, you have yearly access to what they call a free preventative medical package, and they would cover a range of tests in that package, which often will include your blood sugar, your blood pressure, etc. But they also would tend to include a kidney check, as well as cholesterol checks, and for some PSA for men, as well as pap smears for females. Those are the basic ones. Depending on the extent of the plan that you have, some of them will include other tests, such as the ECG that I mentioned before, and another thing we'll call a full blood count. So it really depends on the plan itself.
Okay.
And that is available to you once a year, every single year. So if there are any more questions around that that anyone has, I can elaborate. But that's something that you can come and have done at Urgent Care. We can schedule that, or you can certainly go to any of your providers as well.
I'm seeing another question. Somebody wants to be reminded how they can book a visit to the clinic.
I can see that the BARP admin has responded, but I will gladly share that, there are a series of dates. I do know that BARP prepares lovely flyers and shares them on their social media. So you can feel free to call BARP, the number here, 538-2277, and you'll be able to book in for one of these sessions.
Thank you. Does anyone else have a burning question? No more questions?
Perhaps we may, we were very clear, or either that or we were clear as mud. But if a person have questions, no, we definitely invite them, when they come to the clinic, to come armed with questions. Even outside of these sessions, I always encourage my patients, to come armed with their questions. So right now in your notebook, when you're home and you may be, pondering on what something may be, definitely write that down and come to the clinic armed. We'll be happy to answer those questions for you.
And I think at this point, Dr. Daisy, is also important to point out, we talk about, there's so many conditions that we have not spoken about, which can be sort of unmasked during the medical, and some of which you hold dearly: PCOS, endometriosis, all of that we would get through a very sort of good and constructive medical history. And we know that these are conditions that are women in Barbados, and certainly, we're seeing a high incidence of these conditions, and they're often not spoken about, and they're often not necessarily screened for routinely. So I would like to, get that across, that these are some of the things that, we look broadly and not just at hypertension, diabetes. So, there are lots of things that we can talk about.
Agree. Thank you for highlighting that.
Okay. All right. So at this time, I would invite our CEO, Mr. Steve Allen, to deliver closing remarks.
Good evening to all our presenters from Ross University School of Medicine and our partners, Urgent Care, members of the board who may be on the call, our BART membership, and staff. As we often say, prevention is better than cure. Tonight's presentation reminded us why that is so important. The information shared was practical, relevant, and empowering, giving us the tools to take better care of ourselves. I encourage everyone to make full use of the services available at the Ross Non-Emergency Clinics at our office. This happens monthly. I can tell you from experience, it's complete. If I had to use one word, I would say it's complete. And it's also value for money. Because if you really had to look at what you get from these clinics compared to what your membership fee is, chalk and cheese. You're really getting the best returns for your buck. So once again, I want to say I'm very, very pleased and thankful to both Urgent Care and Ross University for partnering with Barb. On behalf of Barb, I extend sincere thanks to our presenters and to Urgent Care for the continued partnership with us. I also commend our Barb staff for successfully executing another educational Zoom session. We remain committed to hosting at least 2 Zoom sessions a month, therefore trying to keep our members updated and informed and empowered. Thank you for joining us this evening, and we do continue to make health a priority to you, our members. Thank you.